Type 1 diabetes is an autoimmune condition. It happens when the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Insulin is crucial for controlling blood glucose levels, so when the body can't make enough insulin, blood sugar levels rise uncontrollably. But what causes this immune response? The exact cause isn't fully understood, but researchers believe genetics and environmental factors play a role. Certain genes may make some people more susceptible, and factors such as viral infections, stress, or other environmental triggers can activate the immune system to attack the pancreas. Unlike type 2 diabetes, which is influenced by lifestyle factors, type 1 diabetes usually develops in childhood or adolescence, but it can occur at any age. Now that we understand what causes type 1 diabetes, let's look at its symptoms. The early symptoms can develop suddenly and are often quite severe. People with type 1 diabetes may experience frequent urination. As blood sugar levels rise, the kidneys work harder to filter and absorb the excess glucose, leading to more frequent trips to the bathroom. Extreme thirst. The frequent urination leads to dehydration, making you feel extremely thirsty. Unexplained weight loss. Even though the person may be eating normally or even more than usual, the body starts breaking down muscle and fat for energy due to the inability to use glucose effectively. Fatigue. Without insulin to help glucose enter cells, the body becomes energy-starved, leaving you feeling tired and weak. Blurred vision. High blood sugar levels can cause the lens of the eye to swell, leading to blurred vision. Increased hunger. Since glucose isn't entering cells to provide energy, the body may trigger increased hunger to try and get more fuel. These symptoms can be alarming and are often the reason why type 1 diabetes is diagnosed in the first place. Now let's talk about how type 1 diabetes is managed. Unlike type 2, where lifestyle changes can sometimes control blood sugar, type 1 diabetes requires lifelong insulin therapy because the body doesn't produce insulin. The goal of managing type 1 diabetes is to keep blood glucose levels as close to normal as possible to prevent complications. Here are the main strategies. Insulin therapy. People with type 1 diabetes need to take insulin every day. This can be administered in two ways: multiple daily injections, or MDI. This involves taking insulin shots, usually one long-acting insulin to cover the whole day, and several short-acting insulin doses before meals to cover the rise in blood sugar from food. Insulin pumps. A more modern approach, insulin pumps are devices that deliver continuous, small doses of insulin throughout the day. The pump also delivers larger doses when you eat. Monitoring blood sugar levels. Managing type 1 diabetes requires constant monitoring of blood sugar levels, usually multiple times a day. This is done using a blood glucose meter, which involves pricking the skin to test a small drop of blood. More advanced systems, like continuous glucose monitors or CGMs, can track blood sugar levels throughout the day and night, providing real-time data. Carbohydrate counting. Since insulin is needed to process carbohydrates, people with type 1 diabetes must track the amount of carbs they eat and adjust their insulin doses accordingly. This requires an understanding of how different foods affect blood sugar levels and how much insulin is required for different amounts of carbohydrates. Exercise. Physical activity is an essential part of diabetes management. Exercise helps lower blood sugar levels, but it also requires careful planning. People with type 1 diabetes must monitor their blood sugar before, during, and after exercise, as physical activity can either raise or lower blood sugar depending on the intensity and duration. Diet and nutrition. A balanced diet is key. People with type 1 diabetes need to focus on nutrient-dense foods that help keep blood sugar levels stable. They're advised to eat a variety of whole grains, lean proteins, fruits and vegetables, while being mindful of carbohydrate intake. Emergency situations. Sometimes insulin doses may be too high or too low, leading to dangerous blood sugar levels. It's important to know the signs of both high, known as hyperglycemia, and low, known as hypoglycemia, blood sugar. Hyperglycemia or low blood sugar can cause shakiness, dizziness, confusion, and even unconsciousness. To treat it, someone may need to consume glucose tablets or sugary drinks. Hyperglycemia or high blood sugar may cause excessive thirst, frequent urination, and fatigue. If left untreated, it can lead to diabetic ketoacidosis or DKA, a life-threatening condition. In conclusion, managing type 1 diabetes can be challenging, but with the right treatment plan, support, and lifestyle choices, people with type 1 diabetes can lead healthy and fulfilling lives. Insulin therapy is a cornerstone of treatment, and constant monitoring and adjustments help keep blood sugar levels in check. While type 1 diabetes is a lifelong condition, advances in technology and treatments continue to improve the quality of life for those affected. If you or someone you know is living with type 1 diabetes, it's crucial to have a comprehensive care plan, stay informed, and work closely with healthcare providers. Thank you for joining today's session on type 1 diabetes. I hope this gave you valuable insights into the causes, symptoms, and management of this condition. Stay healthy and take care.